2026, the United States marks its 250th anniversary, a moment to reflect not just on the founding ideals, but on the crises that tested them. Just years after the revolution, a different kind of battle unfolded, not for independence, but for survival. Yet, in the chaos, ordinary people took revolutionary action, saving lives, challenging injustice, and laying the foundation for public health in America. Philadelphia, 1793. The capital of the young United States. George Washington had just taken the oath of office for the second time. Revolutionary fervor still permeated the citizenry. But beneath its bustling streets, a deadly threat was spreading. Yellow fever. This epidemic didn't discriminate. It struck the wealthy and the poor, the powerful and the powerless. And no one knew what caused it, or how to stop it. As fear gripped the city, so did debate. Politicians and physicians clashed over the source of the disease and how to respond. Alexander Hamilton blamed French refugees from Santo Domingo and called for closing ports. His rival, Dr. Benjamin Rush, believed the cause was bad air, miasma, and pushed for sanitation. Their disagreement reflected deeper political divisions. Even treatment became political. Rush used aggressive bleeding and purging. Hamilton preferred the bark and wine cure. When Hamilton himself fell ill, he didn't just recover, he took the fight to the press, making yellow fever a national controversy. With city leaders gone and government frozen, survival depended on community action. A group of private citizens formed a committee to manage the crisis, running makeshift hospitals and delivering aid. Philadelphia's free African American community, though excluded from leadership, played an indispensable role. Erroneously believed to be immune from the disease, they risked their lives as nurses, gravediggers, and caregivers. Their courage helped hold the city together. The yellow fever crisis was a turning point. Though the true cause, mosquitoes, wouldn't be discovered until 1900, the 1793 epidemic awakened a revolutionary idea: the need for public health systems. Drawn from the collection of the National Library of Medicine, Politics of Yellow Fever brings to life how yellow fever dominated the minds of early American physicians, and how the flood of writing it inspired helped shape the foundation of the nation's public health system. This exhibition also reminds us that long before the term data science existed, the 1793 yellow fever epidemic generated a wave of hypotheses, reports, and charts. Raw data transformed into public health information. Today, Politics of Yellow Fever challenges us to review these historical records through the lens of data science, asking how past societies used, misinterpreted, and learned from information in a time of crisis. It's a reminder that our understanding of data is always evolving, just like the science it supports.